As Senate Democrat leader, I've seen my caucus make the expansion of health care under the Affordable Care Act a priority in the past 2 years. We've championed this issue, but have struggled to have Republicans in the General Assembly give our proposals a fair debate. At long last, we can claim victory for working Hoosiers, with Governor Pence finally embracing the health care law and submitting a proposal to expand health care to 350,000 Hoosiers. Take a look at this video timeline of moments when Senate Democrats demanded health care expansion over the past 2 years.
It's not only fiscally sound to do this, but I believe it's fiscally irresponsible to not do it.
But we will continue fighting to make sure that every Hoosier in the state of Indiana has access and is covered by some kind of health care plan in an affordable way.
And I would ask us to keep in mind is the human element involved in all this. We'll keep fighting for the rights of Hoosiers in our state to have meaningful participation in the Affordable Care Act.
If we don't accept this expansion, we will be losing out on somewhere between $10 and $20 billion worth of federal money coming to the state of Indiana over the next 7 years. If we don't accept this expansion, other states will be getting our tax dollars.
And there's still not a firm plan from the administration as how we're going to implement the Affordable Care Act. I would think as the major policymakers for the citizens of the state, we'd want to say we want to give the we want to set in policy more clear direction to the administration on how to proceed on this.
The legislature chose not to act on that issue, and that will be a significant step backward if we don't move forward at some point for public health in Indiana, and also, again, 30,000 jobs that could have been created and we could have started on this year.
Some of us in the Indiana General Assembly have been very concerned that we have lagged behind as a state in reaching out to the federal government for the implementation of that important health care coverage for our citizens. We're hoping that it'll lead, of course, to an overall look at where is Indiana at right now, where is the governor's office at in terms of actually fulfilling its duty to make sure that this act is implemented in the state of Indiana. One of the concerns that we had during session was that the proposal to simply use the current Healthy Indiana plan as the tool by which to implement the Affordable Care Act would cause delay and would mean that the citizens of the state of Indiana might lose out on as much as maybe a year's worth of coverage underneath the Affordable Care Act.
I think what's important to understand about using the Healthy Indiana plan, which we have been discussing according to the governor's office with the federal government, is to understand that there are parts of our Healthy Indiana plan that the federal government has explicitly told us would not be appropriate for expansion here in the state of Indiana. Yet the state of Indiana and the governor's office continues to push issues that we believe would effectively not allow people to take advantage of early implementation of the Affordable Care Act, and therefore causing working families to maybe lose coverage for at least a year's time.
I also have to say I disagreed with the governor in terms of his analysis of the implementation of the Affordable Care Act. He said that it would be better for people essentially to be without insurance than to look at the practical solutions of expanding the Medicaid system that we have, and I have to disagree with that. That still leaves many people without insurance.
This man stood there and told the people of this state that it was better that people have no insurance at all than to have substandard insurance because he thinks Medicaid is not quite as good as it should be. While we've got 400,000 people out there with absolutely no insurance at all, and I think that's just tragic.
The governor seems to feel that having no health care program for people in poverty is better than having the Affordable Health Care Act, which he has vowed to continue to fight.
The program that we offered today was a compromise solution. It has been proposed by Republican states and approved by a Democratic administration. You know, Medicaid expansion means insurance for 400,000 people. Medicaid expansion means 30,000 new jobs. And Medicaid expansion means that we bring back the federal dollars that are currently being spent on affordable health care and bring them back to Indiana to spend on Hoosiers. We're going to keep on pushing this. It's our job to keep on pushing this and not just let Indiana keep moving along with no solution to this problem.
Today in the State House, we had a number of groups representing healthcare and churches and local governments around the state that brought in petition signatures and resolutions from local governments to encourage Governor Pence to meet with the federal government and create a plan for expanding Medicaid in Indiana.
Finally, Governor Pence has decided that the Affordable Care Act is the law of the land and has decided to expand coverage. For 2 years, the Senate Democrats have been calling for this repeatedly, and now we do finally have a plan for hip replacement. Unfortunately, by the time this plan is implemented, Indiana will have lost up to $2 billion in federal funding.